Hello, this is Andy Duran, the Executive Director of Lead and SpeakUP, here today with Khris Condon, our Coalition Program Coordinator. And we're here today to present to you a few of the results from the Illinois Youth Survey that our students took here in Lake Forest, Lake Bluff in the spring of 2012. We're here today to talk specifically about how Lead and SpeakUP plan to use this data and how we've already used it and what we plan to do moving forward. And I thought it would be important to share with you some of the results from our community. So what is SpeakUP? SpeakUP is operated by Lead, and its mission is to significantly reduce the level of underage drinking and other drug use among youth in the Lake Forest, Lake Bluff, and Knollwood communities. And we envision a healthy, drug-free community where teens choose to not use alcohol, tobacco, and other drugs. We do this through a number of different ways, and I'm going to turn it over to Khris to talk about our coalition sectors.
Our coalition consists of 12 sectors. We have individuals that are members of our coalition from each of these sectors. The diversity of these sectors is important to the coalition's effectiveness. Some of the sectors provide us information regarding what is currently happening in our community. Others provide us communication channels to help us leverage community resources. So for example, schools, administrators, social workers, health teachers, we share information and partner on events such as the Leaders Luncheon or Parent Teens in the Law. With the law enforcement, we work on policy changes, social horse ordinances, and do compliance checks with liquor retailers, to name a few. With Lake County and substance counselors, we learn from them what is happening on a county level and hear what substance counselors are seeing and hearing from youth in our community. One sector we are working to increase this year is parents. Our prevention strategies use evidence-based practices and data-driven approaches. Our main source of data since 2006 has been the Illinois Youth Data Survey, which is given to the students in Lake Forest, Lake Bluff, and Knollwood every other year. The Illinois Youth Survey has 4 core measures which are defined by the federal government. Over the years of these youth surveys, which happen in many states, the government has narrowed it down to these 4 core measures as being a way to collect and analyze data to affect change in these areas, and that affecting change in these areas can result in positive environmental changes in our communities. So our measures are past 30-day usage, ease of use, perception of parental disapproval, and perception of harm. The substances that we focus on at the SpeakUP Prevention Coalition are underage drinking, marijuana use, and prescription drug or over-the-counter drug abuse. And how do we know that this data is accurate? We are asked this question often. We can tell you that historically 75 to 90% of the students participate, and that the responses are analyzed for consistency, and inconsistent responses are eliminated. This helps to ensure the quality of the data. So we feel confident that the data that we get does represent our youth in our communities.
So let's start looking at some of the numbers and what our data tells us. The slide you're looking at right now is a historical perspective of the past 30-day use of alcohol among students in grades 6 through 12. What I want you to look at first is the top right of this graph where you see the blue box that says 76%. This is from the first year we did the survey. The class of 2006, when they were in 12th grade, reported that 76% had used alcohol in the past 30 days. And remember, this is just of those who reported usage. Let's fast forward a few years to this last class of seniors that we had graduating in 2012, which is the red line towards the bottom of the graph. Class of 2012 reported 63% usage of alcohol in the past 30 days, which is good that we're a 13% decrease from 2006, but it obviously shows that there's a lot more work to be done. Let's look at the class of 2014, which is the first cohort group that we've had go through from the time they're in 6th grade forward. This current group of students are juniors of this current school year. And in 10th grade, they reported use at about 39%, which is consistent with the previous year's class and a little above, actually, the class of 2012. So what this shows us is that we have an opportunity right now to influence the way that this line goes. If it continues on the trend that it's on now, it looks like usage is going to be above the class of 2012. What we want is to make sure this levels out so that we're continuing to see that decrease in usage. The next slide you're looking at here is a cohort view on binge drinking. And the Illinois Youth Survey asked this question. Think back over the past 2 weeks. How many times have you had 5 or more alcohol drinks in a row? And what we're seeing here is that although overall 30-day usage is down, like we saw on the previous slide, binge drinking is trending up. Class of 2012 and 2014, you see the class of 2012 indicated by the red line and the class of 2014 indicated by the blue line, are very similar. They're following a similar trend. They were lower in the 10th grade, but the class of 2012 ended up higher in the 12th grade at 47%, as you see here. So 47% of last year's graduating seniors reported binge drinking over the past 2 weeks. What we need is another survey of the class of 2014 to know if they follow the trend of increasing. We're seeing a similar trend here with the blue line and the red line that you see in the bottom left-hand side of the graph. Again, we see a big spike between 10th and 12th grade. What we're hoping is that that line has a chance to level out as opposed to staying on the current trend that it's on right now. And let's talk about why usage is so big in our community.
This slide shows two core measure results side by side. On the left, it shows how the student's perception of parental disapproval changes as the students age. So in 6th grade, you can see the blue line that says 99%. The class of 2014 said in 6th grade that 99% of the students were positive that their parents would disapprove of them drinking alcohol. But by the time they get to 10th grade, that same class, it has decreased to only 87% of the students think that their parents would disapprove. And if you can look at the two charts side by side, you can see how on the left, as perception of parental disapproval declines, if you look on the right, the past 30-day usage of alcohol goes up. In fact, in our community, a 10% change in parental disapproval results in a 22% increase in drinking. In addition, we learned from our 2012 Illinois Youth Survey data that the access points, where the students receive their alcohol or where they access their alcohol, and our students report at ease of alcohol. If you look on the chart in bold, 41% of the students report getting alcohol from their parents without permission, 29% report getting alcohol from their parents with permission, and 27% get it from an older sibling. In the past, the coalition has focused on retailers, stores, restaurants, and has worked with law enforcement in the area to really target those areas and make sure that there was compliance there. And our police force has done a great job with that. And so now our numbers are lower in those areas, and the coalition feels that it can focus on these 3 areas that the students report ease of access from parents without permission, from parents with permission, and from older siblings. The reason that this is important, this ease of access and this perception of parental disapproval, is that we can tell from the data that students who perceive their parents do not disapprove of using alcohol, those students are 3 times more likely to report having drank alcohol in the past 30 days. They're 2 times more likely to report that alcohol is easy to get, 3 times more likely to report that they get alcohol from their parents with permission, and 2.5 times more likely to report that there is no risk to taking 1 or 2 drinks of an alcoholic beverage nearly every day. So at the SpeakUP Coalition, what we need to learn is the community norms and attitudes around why do youth drink in our community. We have a very high 30-day usage rate compared to the nation. Why is our community youth drinking so much? And why do some parents or adults provide alcohol to the students? And why do youth have easy access to alcohol from their homes in our community? And lastly, why do the youth perceive that there is a change in disapproval from their parents and adults of them using alcohol? So what we're going to do in 2013 is hold listening sessions where we will invite parents and adults from our community to come in for a brief 30-minute interview to share their opinions, perceptions, attitudes, and beliefs around these questions in our community.
Okay, we're going to move on from alcohol for now. We're going to talk about another area of focus that we use in this data set, and that's marijuana. Let's look at our marijuana usage for the past 30 days. The slide you're looking at right now shows the class of 2014, the class of 2012, and the class of 2010. And what we're seeing is that past 30-day use of marijuana increases significantly between 8th and 10th grade. And that's not much of a surprise. But the classes of 2010, indicated by the green line, and the class of 2012, indicated by the red line, you see a similar pattern of behavior, whereas the class of 2014, indicated by the blue line at the bottom, in 10th grade they reported less use. So that's very good. We'll get a better picture in 2014 when this class enters 12th grade, and we'll know if this change is really sustainable or not, or has sustained. Next slide to look at is regarding prescription drugs and over-the-counter medication. This is our third focus area for the coming years. And here's the answer. Here's how the students were able to be asked this question. They answered yes to using steroids, uppers, downers, and or other prescription drugs without a doctor's prescription in the past 12 months. And what we're seeing is that 17.1% of 12th graders in this recently graduated class of 2012 reported using a prescription drug without a doctor's prescription in the past 12 months. The numbers were a little bit lower in class of 2010, and we don't have a data set yet for the class of 2014. So we're going to really work on this to see if we can get that number down. Let's look at the next question here. And this is what we're looking at as a cohort view for using over-the-counter drugs for a non-medicinal purpose. And what we're seeing here is that 18.4% almost of 12th graders reported having used an over-the-counter drug in the past 12 months for a non-medical purpose. So a little higher than using prescription drugs, but still a number that we need to be concerned with. So now that you've gotten a very simple tutorial on our data set for underage drinking, alcohol, marijuana, and prescription over-the-counter drugs, the question that we get is, what can you do about it? What can we do about it as a community? Well, in your own home, if that's a concern for you, you can make sure you lock it up. You can make sure that your alcohol and that your prescription drugs and other medications are locked up, and that you know where they are and that they cannot be accessed by your children or friends of your children. You can draw a line. Draw a line on your bottles of alcohol so that you know that where you left it as a legal adult, where you left your alcohol is at the same level it is the next time you go back to it. Make sure it's not watered down. If you see alcohol in your freezer that is frozen, you know that there's something besides alcohol in there. And sometimes our teens will replenish what they drink with water, so make sure it's not watered down. Pay attention to your stock. Make sure you know what you have and where you have it. Maybe it's not in the fridge, but you have it in the garage or you have it in the basement. Just make sure you know what you have, and if you see something missing, don't hesitate to ask questions.
So what can you do to get involved? First, you can sign up to participate in our listening sessions, which will be taking place in January 2013. If you contact our website, you can send us an email letting us know that you are willing to participate in the listening sessions, and then we will contact you with our calendar and dates so that you can choose a time slot that works for you. You could also attend the SpeakUP Coalition meetings, which occur the first Thursday of every month. The meetings are from 9 to 10:30, and the meeting place is in room Seminar B at the West Campus of District 67's administrative offices. You're welcome to join us at those meetings anytime. And then lastly, visit our websites. There's a lot of great resources out there about our upcoming events, about what parents can do to help children with avoid underage drinking and drug use. Lots of answers, lots of resources. So please check out those websites.
Thank you for listening today, and certainly thank you to our partners, especially our school sponsors, District 67 and 115 in Lake Forest and District 65 in Lake Bluff, for working with us to roll out this data and for having the students take the data in the schools. They're a big piece of our coalition, as Khris talked about before, one of our main sectors, and we certainly appreciate their partnership and involvement. Please visit our website and contact us for further questions.